The mayor pointed out 2 days ago when we talked about the rate of infection in the city of Houston, because we look at the numbers, but we also need to focus on the rate. So we have a slide coming up. This talks about the number of cases of COVID disease per 100,000 population. And this is important because it kind of reflects how notice that the city with the greatest number of cases, the greatest rate per 100,000 was New York City, followed by New Orleans, Chicago, and then Los Angeles County, and then Houston. And so in terms of rate of cases per 100,000, Houston is right now. Also recall, however, that in New York City, they've done a great job of slowing down the virus, and their rate is not growing very much, nor is New Orleans. Chicago still has an issue in Los Angeles, but we have caught up with our sister cities of the big cities in the United States. If we go to the next slide, so that's the bad news. But again, New York City had the largest number, followed by New Orleans, Chicago, and Los Angeles. But if you look on this slide, you're going to have to go way over to the right to find Houston. That's relatively good. We really need to thank our colleagues who work in the hospitals. Why? Because you can see between these two slides, it's not that we don't have the virus spreading through our community. It's spreading, as the mayor said, it's spreading, and it's rampant. My fear is that our histogram is going to continue to enlarge or get larger, and we'll start catching up with those cities that have greater rates than we have. But don't let anybody be fooled that just because the number of deaths they're reporting is comparatively low, that we don't have an issue. That's not because the virus changed, because our doctors and nurses have become more expert. So today, once again, right now, if you look at the number of the hospitals, go to the CETRAC webpage, you'll see that there are just about 700 people in Harris County Hospital intensive care units. 700 people are fighting for their lives in the intensive care units in Harris County alone. And there's another 1,600 patients who are admitted to hospitals that are not yet in the intensive care unit. That is a huge number of people. Now, let's also talk a little bit more about numbers. So in the city of Houston, we have about 8,000 adult hospital beds. That's a population of 2.3 million. So if you do the division there, that's about 0.3%. Number of hospital beds divided into the population, about 0.3%. And we know that most people don't get terribly ill with COVID. In fact, we say that 80% of the people have minimal or no symptoms, and only about 20% require health care. So that's 1/5. So if you take 0.3 and multiply it times 5, that's 1.5. So if at any given time, 1.5% of the population had COVID disease, that would fill every single adult hospital bed in the city, leaving no room for heart attacks and strokes and pregnant women who are having their babies and car accidents and everything else that continues to go on. So while most people are walking around saying, I don't understand what the problem is. I don't know anybody who's sick. I don't know anybody who's died. I feel fine. The problem is that while you feel fine, you may be somebody who's infected and spreading. You may be one of that 80% who has minimal or no symptoms spreading the virus. And if the virus continues to spread uncontrolled like it is now, we will rapidly approach a situation where our hospital partners, who in spite of the truly tremendous work that they have done to take care of everybody who needs a hospital bed, they're going to be overwhelmed. There is a limit to the miracles that they can perform. So we need to keep ahead of this. So I just want to put in perspective for those folks who don't see what the issue is. And you're right. In your experience, you may not know anybody who's sick, and you may not know anybody who's died yet.